Philadelphia plans to pay expectant mothers $1,000 a month during pregnancy and another year after birth with, quote, no strings attached. They say it will help with Philadelphia's child mortality rate, which far exceeds many of America's biggest cities by double digits. So Philadelphia definitely has a problem in a country that has a problem. America ranks 33rd out of 38 of the world's richest countries for infant mortalities. We have 5 times the number of deaths as Iceland. And not surprising, it hurts minorities and poor communities the worst. Dr. Stacy Kalman, the director of Philadelphia's Maternal and Family Health Division, announced the $1,000 a month pilot program this week. They will try to get it with 250 mothers in Philly's poorest neighborhoods. Do the math. That comes to $4.5 million, which, if it works, could change a lot of lives. Dr. Callum declined our request for an interview, but we are honored to have Dr. Corey Hebert, Assistant Professor, LSU Health Sciences, Chief Medical Officer, Dillard University, former Chief Medical Officer for New Orleans Public School District. The court has accepted you as an expert, sir. Thank you very much. With your resume, all right, unquestionably a real problem, especially for minority communities. Does this make it better or worse?
Well, the issue, I think, is much more broad than this. And I think that this is misguided because the social determinants of health, where you live, where you love, where you work, and where you play, all these things make a difference in whether a child is going to thrive. Now, a cool G is not a bad thing for anyone, but to say that to give $1,000 just giving it to every mother for the entire pregnancy and after is not going to really address the systemic problems about why children don't do well and why there's infant mortality. We know that maternal mortality during childbirth for African-American women is basically the same as many underdeveloped countries. So there's the implicit bias of the medical community that really plays a bigger part than this than just the money that's going to be given. Now, just remember, we have what's called the Family Medical Leave Act, the FMLA. When you have that, you can get your time so that you can have your baby, but you have to go back to work in 6 weeks. So the issue now is this $1,000 really going to help, or would it be better put that almost $6 million into a program so that we can actually teach people how to be better parents as opposed to just give them $1,000 so they can do whatever they want with it?
All right, I'm going to read you the quote from Stacy Kalman, director of the Philadelphia Department of Public Health Division. The no strings attached, in her words, is key. We are respecting the dignity and autonomy of program participants to use the funds as they see fit to improve their health and the health of their babies. Has just giving money away to be used as people see fit, no strings attached, ever gotten the best public health results?
No, well, they cite some data to show that there's some increased birth weights on people that have been given money, throughout their pregnancy. But the problem is this. I would not have a big issue with this if you would give $1,000 worth of training to be a better parent so that you can learn how to do things that would help your child. Serve and return, meaning, read to your child a certain amount of hours a day. Make sure the child has great nutrition. Make sure that the support network for babysitters, all those types of things are very important. But to give someone $1,000 with no strings attached, that means that the person that may have had a problem with their pregnancy or does not have the support will buy things that may or may not be in the best interest of the child, so that they can bring forth the things that the child needs. So to give that away, that needs to have some earmark on what you're going to do with this money, and that I think is the biggest problem.
All right. The invitation to Dr. Kalman is always open here on the program. Dr. Hebert, it's always good to see you. Thank you.
Thank you very much.
Yes, sir. See you soon. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.